Hey, well, we are here at BioFuture with Mylene Yao of Unify, and we have a couple questions. I just sat in on a fantastic panel talking about women's health, and I'd love you to just talk a little bit about what Unify does and how you got into this whole area of women's health.
Sure, Susan. So yes, that was a really fantastic panel, really passionate about women's health, and in particular the fertility space. So I'm CEO and co-founder at Unify, and Unify is an AI platform that focuses on the patient's experience when navigating fertility treatment options. So we are improving the success and affordability and access to IVF treatments and other treatment options in fertility care. We really are aiming to help every individual and couple to be able to access fertility care in order to have a family.
So, I mean, it's such a heartwarming space, but I know there's a lot of data involved with Unify and how
Yes.
you help couples come to the decisions that they must come to. Can you talk a little bit about the data piece of this?
Sure. So I think, the reason that we, decided to start this company and use AI and machine learning to help couples understand their probability of success when doing IVF or other treatments really comes from my firsthand experience a while back when I was OBGYN and also, seeing fertility patients where I saw every woman, every couple ask their doctor, what is their chance of having a baby if they were to do this or that treatment? It's the top, most commonly asked question. And I felt, that firsthand as doctors, we were not very well equipped to really give an individual the most personalized, the most accurate information possible, backed by data. And so this is a very big question, is a decision that is life altering for the women or the couple. And a lot of times it also can impact how much money they have to spend. Because even though more and more people are getting funding and from their benefits program to put towards fertility treatment, still most people do not have complete coverage, and out-of-pocket costs can be significant and can be a barrier. And so by understanding your probability of success and knowing in advance how many treatments might you need can really help a couple make the right plans and budget so that they could achieve their goals. And that's what motivated me and my team to be using AI and machine learning to provide that degree of transparency.
That's amazing. So if I was to take this piece of women's health and kind of go broader, I heard some statistics today that I've been in this industry for so many years and they blew my mind. And a couple of those were things like women's inclusion in clinical trials is so low. And so, with a focus on fertility and the things around it, can you talk a little bit more about the facts that will catch people's eye and attention to put attention in this women's health arena?
Yeah. So I think a lot more and more people are recognizing that women's health is important. But to put some number around it, there have been all kinds of estimates. But what I hear a lot is that the women's health market globally is expected to reach over 50 billion by 2030. And so that really maybe help people think about how big an opportunity it is to help women be able to live better and more productively and have better, quality of life. So I think a lot of times when we talk about women's health, what are we really talking about?
Yeah.
Right? So there are different definitions out there, but I kind of look at it as women's health as like a woman's journey through life from, the teenage years, puberty, all the way to old age, and the different kind of life stages that a woman would go through and the different health issues that she might encounter. Some of the health issues are reproductive health issues that are really specific to being a woman. But some of these health issues may really be, health conditions that men also have, but they manifest themselves differently in women. Or so the women's experience may be different, or they may be affected differently, because we do have different biology, and no one can change that. But that's not well addressed, and as you mentioned, because for a long time, women are not even included or mandated to be included in many clinical trials. And so for conditions that affect men and women, the treatments that have been developed may not address women as adequately as they address men.
Okay.
And that is one thing that I know a lot of people, in the life sciences sector and others are really coming together to really change that. And now you are required, to include women in clinical trials. So that's great, but I think that's just the beginning.
Okay.
There's so much more that we need to do.
And so taking that all the way into the area that you have started Unify around, what are some of the facts and figures around those statistics? How many people are struggling with this, and talk to us a little bit about that.
Right. So even conceptually, what we think of fertility has changed a lot because we're recognizing and being more and more inclusive. So traditionally, we know that there are heterosexual couples that have tried to conceive without success. And that number is somewhere around 1 out of 6 couples in the reproductive age group. But that definition has expanded tremendously now that we really understand there are individuals and couples in the LGBTQ community that want to have their own family, and they need to be supported, and they need fertility care in order to have a family.
Yeah.
And there are also single women who have now the opportunity to do egg freezing to preserve their fertility. It is now a treatment that is no longer considered experimental.
Okay.
It is now accepted and widely accepted in the fertility world, with a lot of data that has been reported. So there you have single women, but also men and women that have medical conditions where the treatments can impact their fertility adversely. So they also could preserve their fertility with different options.
Okay.
So the definition of fertility care is very broad now, and it's really great that we have made these advances, from the fertility space, and also have been educating employers about all these options, so that they become more and more included as a standard part of healthcare.
This is fascinating. So, one last question on that very subject. How does this tumble into, reimbursement and benefits? And does Unify, I believe, from what I've heard, you help just educate on so many levels, but you also provide data not only for people. Does it translate? How does it translate into that whole arena? How do you pay for this?
Yes. So paying for it is very important. And then going back, why is that challenging?
Yeah.
Right? Why did it take us to start a company to address that? So IVF treatment is the most effective treatment for most people. It's not the right treatment for everybody, but for most people it's most effective. However, it is kind of like flipping a coin, except it's not a 50-50 heads to tails. So for some couple, it might be 70-30. For some couples, it might be 40-60. And knowing your personalized probability of success from IVF is really important, because that can impact you to understand how many treatments might it take in order to have a baby. And knowing that, what we call cost success transparency is a way to help really put the treatment and the cost and how to actually achieve this access all together. And a lot of employers, I think over 40% of large employers and over 27% of small employers are supporting family care, family building care. However, what we're seeing firsthand at Unify is that many of these employees they might exhaust their employer's funding and still not have a baby. And then they're basically on their own paying significant out-of-pocket costs But had they known what that path might be like, they could have, they could have chosen options. And there needs to be a lot more integration between the benefit side and the cost success transparency and the provider side. And Unify is trying to connect those dots so that we can help employees minimize the out-of-pocket costs and actually achieve the family that they want.
Wow. Well, thank you for shedding light on this. It has been really fascinating to talk to you. This is an area I think a lot of people did not know as much as we should have. And we really appreciate you being here at BioFuture this year.
Thank you, Susan.
Thank you. Take care.
Nice chatting with you.